This is Abia COVID-19 update.
Abia COVID-19 update.
COVID-19 is real and you should stay safe. I will keep reminding you of the precautionary measures. So it's very important. Frequently wash your hands with soap and water for at least 20 seconds. Very, very important. When soap and running water are unavailable, use an alcohol-based hand sanitizer with at least 60% alcohol. Avoid touching your eyes, your nose or mouth with unwashed hands. Practice good respiratory etiquette, including covering your coughs and sneezes. Avoid close contact with people who are sick. Don't go out if you're feeling sick or have any cold or flu symptoms. Very, very important also. And also stay at least 6 feet. That's 2 meters away from people. Cover your mouth with a tissue or the inside of your elbow whenever you sneeze or cough. Very, very important. And you can also walk into your local government area headquarters. There is a massive community testing presently ongoing in all the 17 local government areas of Abia State, and testing is free. You can also call the 247 toll-free line of the Abia Telehealth Initiative 0700 2242 2362 0700 2242 2362. Well, as the number of confirmed COVID-19 infections in Nigeria increases, contact tracing of patients in communities is becoming more difficult for health officials as persons to assist contact tracers due to a fear or stigma missing right now, because current COVID-19 outbreak has provoked social stigma and discriminatory behaviors against people with confirmed case. We've seen people even call on radio stations demanding names and locations of confirmed patients. It is understandable that there is confusion, anxiety, and fear among the public, but unfortunately, this can result in more severe health problems and difficulties controlling a disease outbreak. Drive people to hide their illness to avoid discrimination, prevent people from seeking healthcare immediately, discourage them from adopting healthy behaviors. But we'll take a look at stigma this morning and some other issues concerning COVID-19. This is Abia State COVID-19 update, the last edition for the month of July 2020. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19 in Abia State, and also the governor's efforts, Dr. Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. This program is running simultaneously Mondays through Fridays on several radio stations in the state: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. Well, I will give you the figures and the updates later on this morning, but that will be after the first time out on the program. But one of the biggest impediments to the fight against COVID-19 is a lack of belief in the existence of the virus vis-a-vis alleged government's handling of the information. Well, if you're still doubting, we have taken another step towards convincing you on the existence of the virus. Yes, we had the governor come out, that's Dr. Okezie Ikpeazu, come out to tell his story. But going further, we have another COVID-19 champion. He's very much in the studio with me this morning. Of course, he speaks for an higher institution right here in Abia State. Of course, the spokesperson of Gregory University, Uturu. He's a senior colleague and also a renowned broadcaster. So I will call him a senior, while you will call him Mr. Slick. Slick Ogbonnaya Ogwo. Good morning to you this morning on Abia State COVID-19 update.
Good morning, Michael Oni. Thanks for having me.
Oh, good to have you join us this morning. You're a COVID-19 champion.
Yes, I am benefiting from my own personal experience, and
Interesting.
That enables me to be somebody that can talk boldly on that very subject. I can boldly say from my own personal experience, yes, that I'm a champion.
Interesting. I'm so happy for you. Firstly, how does it feel coming out to tell your story?
Well, actually, I think it has to do with the person's personal background. If you're somebody who has the kind of background that I have, then you want to believe that everything that happens to you is not just for happenstance. It just didn't happen. it must have happened for a particular reason. And for me, some of those things that happened to me are actually lecture notes, which I must share with students. So, so actually what happened to me, I see it as something that I need to use to also begin to enlighten people about the veracity of the very challenge that we're having right now. And so that's how I see what happened to me.
Okay, I will take you on your experiences and how you got to know that you had COVID, and the reactions, the immediate reactions of your family members later on this morning on the program. Let's quickly run through the figures and also updates of the coronavirus globally. Global number of deaths stands at 677,017. That's as at 8 a.m. today. Meanwhile, the total number of infections worldwide is at 17,489,179. Also, the number of recovered cases is at 10,951,895. The United States has become the worst affected country, with more than 4.4 million diagnosed cases and at least 152,055 deaths. The World Health Organization Chief Tedros Ghebreyesus said surges in the number of new COVID-19 cases in some countries were driven partly by young people letting down their guard. But that the world needed to learn to live with this disease. And that's according to WHO. And yesterday, Nigeria announced 481 new cases of COVID-19, bringing the total number of infections in the country to 42,689. That's 481 new cases were recorded in 17 states in the country. Now let me get back to Mr. Slick telling his story, how he survived COVID-19. At what point did you suspected that you had COVID?
Yes, actually, I think so many people are going through similar experience right now.
Okay.
I was down with bouts of malaria and typhoid. And of course, the doctors prescribed the drugs that we're familiar with. And after bouquets of treatment, about 4 times, treating
malaria and typhoid. Okay.
I saw that I wasn't getting any better. It got to a point that I was getting weaker and weaker, and it was prescribed by the medical personnel that I should do infusion and all that, and we began infusion. But I still saw that I was still having the same symptoms of fever, chills, bitter mouth, and of course, I was not beginning to have difficulty breathing.
Really?
So at that point, I conferred with my medical doctors, and they were like, well, you need to now go to the hospital. And I went to the hospital. I went to FMC. They said, go to FMC. We got to FMC, and then we looked around the environment, and it appeared as if there was this fear, hanging in the air. And that was a Saturday. And then we advised ourselves again, say, why don't we confront this thing boldly? Let's go to Amachara. Let's go and find out what is really going on.
Okay.
And then I had somebody drive me in my vehicle to Amachara, and we got there, and we were able to benefit from the testing services, and graciously that same day the result came out.
Okay, that's because we have a laboratory in Abia State. So
yes, that was in the morning that the samples were taken, and then by evening I was called and told that my result came out positive, and I needed to come into isolation.
At that point that you got to know your result, how did you feel?
How did I feel? I mean, I felt like I needed help.
You didn't panic?
No, it is not a death sentence. Like I said at the beginning, you need to know the background you're coming from. Haven't had so much information about the disease called COVID-19. I knew it's not a death sentence. I knew that definitely the mortality rate we're having in recent time is not so high. And I knew that it's something that you just need to submit yourself for the necessary therapy, and you come out from it. So that's what happened at that time. I submitted myself for isolation from that day, and I went through the period of isolation and came out negative at the end of it all. That's what happened. Okay,
the period of that you got to the isolation center and the period you came out of the isolation center, how many days?
Well, the normal thing is 14 days, and we went through all that season, And at the end of it all, submitted ourselves samples for another testing process, and this time it came out negative. And then we were released to go.
Tell us your experience while in the isolation center.
Well, the isolation center is another world of its own. You are definitely isolated from goings on around immediate personnel, and so many people will have missed some of the things, some of the content I will have dished out at that time, but they didn't know what was going on. I was in this quiet place and receiving treatment morning and evening, my vital signs being taken by the medical personnel in that place, who are, by the way, are very, very, very courteous and very nice.
Interesting.
Yes, they are, and very dutiful.
That's the Amachara Isolation Center.
Precisely. Up till now, I maintain a healthy relationship with them. I call them, I say, they ask me how you doing. I saw one of them yesterday, and they wanted to find out how you doing now. So I'm better. So it's a period of medication. What happens there is that they watch your vital signs to monitor your progress, and if there's any challenge, they'll now know what to do to ensure that you leave that place better than you came.
Interesting. I will like to run through the doubts, what you make of the doubts by some members of the public. But let's take a breather now. It is still Abia State COVID-19 update, and of course we've been speaking with the COVID-19 champion right here in Abia State, managed in Abia State as the Amachara Isolation Center, and of course he tested negative at the end of the day. Mr. Slick, that's what I know him as, but he's Slick Ogbonaya Ogbo, a senior colleague and a renowned broadcaster. It is Abia State COVID-19 update, live on several radio stations in this state, Abia State.
This is Abia COVID-19 update.
Abia COVID-19 update.
All right, it is still Abia State COVID-19 update, and we're still talking to Mr. Slick, very much in the studio, a COVID-19 champion. And, Mr. Slick, I would like to take you through the disbelief among our people, especially here in Abia. But we're so concerned about the situation in Abia State. We still have this disbelief among the members of the public, not taking this virus serious as it should be. It's a pandemic ravaging the world, and there are protocols highlighted by the WHO, protocols put in place by the NCDC, protocols put in place by the Abia State government. But we still see people going around without their face mask, people going around like it's a normal thing. But there is a new normal in town. I don't know how you want to react to this, being a champion of this disease.
Well, I want to look at it from the complete picture of the Nigerian environment. Actually, in Nigeria now, you have a situation where policies of government are being doubted by the public. Oftentimes, you see that when a government agent pronounces a particular policy, people will see it from the point of view of the fact that it benefits the government agent. They don't see it from the point of view that they don't want to believe that very information. Oftentimes, you see somebody as big as the Minister of Information saying something. They say, how can I take something from that guy? I can believe him. So now, in communication, the source of the information is very, very important. When you discover that information trickling down from a particular source is not being received, then you try another strategy. And that's what I've been preaching ever since. You try another strategy.
Which is?
For some time, what you do is, if, for instance, when we had the HIV problem in Nigeria, for instance, and people were afraid of all kinds of things, they were not believing the government, apparatus of information. What the government did was to begin to collaborate with funding agencies from outside. You had things like USAID. They came out with massive campaigns, and they were creative campaigns that were adapted for our people to buy into and believe. Now, I'm not saying that we're not doing much. I'm saying that we should do much more now in terms of creating avenues of disseminating this information that will enable our people buy into the information. Okay, the result is this. Whenever you send out an information, it's only considered successful when the recipient of the information begins to do what you want him to do.
But that's not the situation we
That's
have.
what
on
I'm
ground.
saying. It simply means that we have to go back again and check how we are sending forth the information. Why is it that we are making so much noise, if I should use that? We are communicating, and yet the people don't seem to understand or don't seem to buy into what we're saying. So we need to go back again and investigate how we're doing this. I believe that if we can begin to think about more creative ways of engaging the people. For instance, okay, the governor said something very vital yesterday at the stakeholders meeting, and was talking about finding ways to reach our people through the communities, getting to their traditional rulers, to hold town hall meetings, and through such channels. First of all, you need to equip the traditional rulers with the necessary information they need to have. Break it down to market leaders in the marketplaces and let them have the requisite information so that they can as well assemble the traders and disseminate this information from the point of view of the language that they can understand and the creative ways that they will see this thing as being real. So I'm saying that we need to do more in the area of communication vitally so as to sell this message to the people. That is one of the reasons why the people are not believing our story.
Now, people, I believe you will be the best position to tell us about the vital signs and symptoms that we should look out for, especially as far as COVID-19 is concerned. Many persons, in my opinion, I believe they've even recovered from this COVID-19 staying at home without even coming outside. But that's very risky. When you are treating yourself, you don't know the ailment affecting you at home, and you are transmitting such to others unknowingly in the name of self-medication. So I would like you to take us through.
We're just dealing with the latter part of your question.
Okay.
The area of you sitting back at home and then treating yourself, I want to discourage that as much as possible. Why? Because of the fact that it is very, very dangerous. It is a situation that, of course, will predispose you to, being a carrier onto so many other persons.
Asymptomatic sometimes.
Yes. The best thing that anybody should do once you affirm positivity of this very ailment is to isolate in the isolation center, not in your own place, because now in the isolation center, the people there cannot come to you without the complete PPEs. Okay, so I don't know, when you isolate in your own space, whether the people that come to you to give you medication, to give you food and all that, whether they will also wear complete, I'm talking about full gear from head to toes. They are fully covered, and they come to you and they attend to you. They check your vitals, and you mentioned, what are they looking at? They're looking at your blood pressure, they're looking at your breathing, the movement of blood within your system, or that they're checking the percentage of that flow of blood in your system. They're trying to find out whether things are normal with you. Also, they're considering the fact that you might have some pre-existing conditions. You might be hypertensive, you might be diabetic, and they're also checking if these things are going to worsen the situation, and they're bringing they're checking, giving you drugs for all those things at the same time. So I just think that anybody that has symptoms you suspect to be associated with COVID, the best thing you need to do is go and do the test,
which is free.
Go do the test, and if it turns out negative, for goodness sake, you can go home and treat malaria and typhoid or whatever it is,
but not COVID.
But if it is positive, the best thing you should do for yourself and society, I repeat, for yourself and society, for yourself and your family members, is to go to Amachara and isolate yourself. I hear that so many people, well-to-do people, prefer to sit at home and get treated there. The danger is that you might receive treatment there, but you don't know whom you're passing this thing on to while doing so. So the best thing is, for that season, isolate yourself at the isolation center.
I would like this conversation to be a two-way conversation. Let's throw the lines open. We have less than 2 minutes to wrap up the program this morning. Abia State COVID-19 update. Let's take 1-2 questions before we wrap up the program this morning. The program is live on several radio stations in the states. 0808-182-6949 or 0811 2949. Also drop messages on 0906 510 8289, 0808 182 6949, or 0811 605 2949. It is Abia State COVID-19 update. Good morning to you. Okay, we lost that. Hello, good morning. You're live on radio. Good morning to you. Hello, good morning to you.
Yeah, good morning.
Yes, good morning. What's your name?
Akonia.
Okay, quickly, you have 30 seconds, please. Thank you.
Yes, he is saying that to isolate the person to go to Amachara. But I want to say something here. If the governor started by going to Amachara, there is a leader that going to others will follow him. If our own governor is seated in Abuja, in his own house in Abuja, why are you not telling the reformers to go to Amachara? Thank you very much.
All right. Hello, good morning to you.
Yes.
Hello, good morning.
Hello, good morning, Michael.
Welcome. You have 30 seconds, please.
Good morning. My name is
Can you change your location so that we can have a better reception? Very poor reception there. I will have to let you go. Sorry about that. Hello, good morning to you. We lost that also. Just one for the road before we wrap up the program this morning. Hello, good morning to you. Hello. Good morning. Hello, good morning. Okay, seems we will not be able to take get reactions on the phone lines because of the bad network. Hello, good morning.
Hello, good morning.
Yes, quickly, you have 30 seconds. What's your name?
My name is Emmanuel Ezindo. I'm calling from Omaya.
All right, Emmanuel, what's your contribution?
I want to ask, that COVID-19 champion, the people that took care of him, both his drivers and the people that took him and taking care of him, they did not isolate them.
Okay, he's asking.
Yeah, Emmanuel, I got the question.
Okay.
Normally, what happens is that once you test positive, there's contact tracing, and the people around you at that particular time are also by necessity asked to go through the tests. And in my own case, they tested negative.
Okay, so those are the first.
Somebody asked about governor and league and Abuja and all that, and
Yes.
I'm saying, why don't you be selfish about your own problem? If the man, for some reason, had to go somewhere else to get treated, you yourself, do you have the ability to go to New York or go elsewhere to get treated? Government has provided a place and it says the place is free. Why don't you just go there? Everything is given to you, including food, is given to you free for 14 days. Why don't you just go there for your own sake and for the sake of members of your family?
All right, I really want to appreciate your time. Time will not permit to continue the program this morning. Many thanks to the partner radio stations, BCA FM, Flow FM, Buzz FM, Real FM, and Vision Africa Radio. Mr. Slick, thank you very much. In fact, I know it's a very big decision coming out to tell the public that you once tested positive to coronavirus and now you're negative.
Let's deal with that subject. Actually,
Okay.
So many people are living in denial.
Okay.
And that is very, very wrong. The issue is that it is not, the governor said it in his own pronouncement, it's not a death sentence. If you go through the experience and you come out from there, first of all, you give thanks to God that you passed through an ailment and you came out successful. Second of which is it becomes a preaching post for you to tell other people who doubt the believability, who doubt the existence of such an ailment, that it's actually that I went through it. You know, Jesus said to Thomas, come and touch me here.
Yes.
You know, if you're still doubting, come and see. I am somebody who survived it. It's possible for somebody to survive it. First of all, it's possible for somebody to contact it. It's possible to survive it.
Okay.
If you do what the government has pronounced as protocols, you'll be able to. So then, final thing, I just want to say the final thing is the fact that on the strength of that, you can become a campaigner trying to convince people about the need.
Coronavirus. All right. Thank you very much. And my name is Michael Oni. Stay safe and take responsibility.
This is Abia COVID-19 Update.
Abia COVID-19 update.